Today I want to go over the multiple choice section of the AP Psychology exam and how to answer the questions. In general, compared to other writing-heavy courses like AP English or any of the AP Histories, AP Psych has an easier free response section, mostly because you don't have to write any essays. Instead, you have short answer questions, and there's a bulleted list of terms and topics that you have to cover in your response. However, on the other hand, the AP Psych multiple choice section is just the same as every other exams, and it's very important that you do well on it because it's more than 50% of your overall score. Topics from all the units will be tested, so you must have a thorough knowledge of just about everything. Generally speaking, the units you will see the most are clinical psychology, motivation, emotion, and personality, cognitive psychology, and scientific foundations of psychology. So let's look at this last one first, scientific foundations of psychology. Scientific foundations of psychology will mostly be about research methods and some famous psychologists in the respective fields. For example, you might see a question like this. While this question involves knowledge about different fields of psychology, this is something you can easily answer if you know famous psychologists and the different schools of psychology they're from. For example, you might already know that psychodynamic psychology has to do with Sigmund Freud, while cognitive psychology might be connected to Jean Piaget. Let's go through the answers one by one. You'll no longer need to use elimination when you've studied enough, and by then you'll be able to tell the answer right away. But I think elimination is also a good method to practice. So first, B, self-efficacy, refers to an individual's belief in their capacity to complete a task or achieve a goal. If I believe that I can excel at ballet with enough time and hard work even if I've never tried it before, I have high self-efficacy. This answer doesn't really match up with the question, as Dr. Pratt is treating a patient with depression by changing the way they interpret events. Helping an individual believe in their own abilities is more innate and less about how one views external circumstances. Also, self-efficacy is a concept, not a form of therapy, so B should be eliminated instantly because the question only wants a type of therapy. C, biomedical therapy, probably looks off right away. Changing someone's perception of events has nothing to do with prescribing them medication to resolve psychological issues, so this can be eliminated right away as well. D is learning. Learning is associated with acquiring new unfamiliar knowledge to expand your mindset or intellectual capacities. Once again, just by simply using common sense, we can see that learning has nothing to do with changing one's viewpoint, at least in this situation. Therefore, D is also out. Next is E, psychodynamic therapy. You might hesitate here because psychodynamics is strongly connected to the individual and the subconscious, so you could think that the subconscious has to do with changing your interpretation of events. However, we also have to take into account the methods of psychodynamic therapy. A psychodynamic therapist will almost always use Freudian methods like free association with their patients. So we should see whether these methods match the question. First, free association is usually when the therapist gives a visual or verbal prompt and the patient says the first thing that comes to mind. That doesn't sound like what's happening in the question, where the therapist is trying to change the patient's way of thinking. Another psychodynamic method is dream analysis. This is very ambiguous and not too accurate. It's when the patient talks about their dreams with the therapist, who analyzes them to find underlying hints or desires. Again, that doesn't seem to fit at all, so E seems very unlikely. Now to A, cognitive therapy. Cognitive psychology is about how one thinks and processes information. Already, this sounds like it might match the question. One of the most famed methods in cognitive therapy is called rational emotive therapy. This is when the therapist helps the client identify irrational, illogical, or negative beliefs and thought patterns in order to turn them into rational, more objective thoughts. That corresponds with the question because that's what Dr. Pratt is doing. Essentially changing the ways the patient with depression thinks and processes events because it is negative and unreasonable. Therefore, select A as the best answer. As you can see, almost all AP Psych MCQ questions are knowledge-based and do not require much inference or deduction. You will be able to answer all those questions as long as you study the key points of each unit in detail and know all of the key topics. Motivation, emotion, and personality is another big unit. This unit is about all sorts of theories theories of motivation, of emotion, of personality. What's hard is that you have to know theories from each school of psychology, and they're all different even though they're about the same things. For example, when it comes to personality, the psychodynamic, humanistic, and behavioral schools each have their own theories that are vastly different. Lastly, there's a small section on types of personality tests used to determine personality. Knowing all this, let's read this question. This question is completely knowledge-based, as you might have noticed. You just have to know it, and there's no way you could get it by inferring or guessing without some background information. Abraham Maslow was a psychologist who created the hierarchy of needs, which is basically a list of things humans need, with the most basic necessities at the very bottom of the pyramid and the more lofty goals toward the top. This is what the pyramid looks like. As you can see, the most basic needs for humans are food, water, warmth, and rest, as well as security and safety, which are a bit above those. And at the top, we have self-actualization, which is achieving your full potential. This is no longer done for mere physical survival. It's more like something humans seek when those basic needs are completely satisfied and they seek to feel purpose and meaning in their own existence. Now, knowing this, we just simply have to match one of the levels of the pyramid with having respect for ourselves and being valued by others, which was what was stated in question. This means that you feel self-accomplished and also a part of your community. This is not belongingness and love, because that's more basic. It just means that humans want to have friends and family. The question goes beyond, because it's about seeking value in those relationships, not just having them. The best answer would be D, esteem needs, which is a feeling of prestige and accomplishment. So to get a better idea of what kind of questions you'll see, let's do a few more. This question is evidently knowledge-based, and there's no way you can make a best guess unless you know John B. Watson's beliefs well. One of the things Watson is known for is the Little Albert experiment, which is essentially about conditioning. Conditioning is a key topic in the school of behaviorism, and you'll just have to know that fact. Therefore, A would be the right answer. The MCQ session also involves some graph interpretations, but not many. In this question, you will first have to understand the data presented in the graph, then choose which of the interpretations fits best. You will also have to know what conformity is and how it works to do this question. We can see that the trials on which participants conform rises steeply at first, then levels off at around 4. So when the size of the incorrect majority reaches about 4 individuals, the percentage of trials on which participants conform will no longer increase significantly and will stay consistent at around 35%. The best answer would be C. Conformity increases as group size increases to about 4 persons. It does not keep increasing after 4, so A is inaccurate. E is wrong because there is definitely a relationship between the two axes. B and D are also incorrect because they imply a gradual decrease, which is not what is shown on the graph. Next, this question also involves graphs, but the data is not as specific. Each graph has a general shape and distribution. For AP Psych, you don't have to know these graphs in too much detail, but you will have to understand standard deviation and variation. Variation in particular is basically like the range of a dataset. It's how different the data at the ends are from each other. So A cannot be right, because distribution A is narrower than B, so it doesn't have more variation. C is also incorrect, because B and C obviously have different variations, as B is wider. D and E just don't make sense, because infinite standard deviation just isn't part of these distributions, and a standard deviation of 0 would not produce a curve at all, because all data points are the same as the mean. Therefore, B would be correct, because its data ranges wider than both A and C. This last question requires knowledge about the stages of moral development, which is covered in one of the later units. Essentially, Lawrence Kohlberg proposed a theory of moral development in humans from infants to adults. According to him, children first enter the pre-conventional stage, which is when they follow rules to avoid punishment and act in self-interest, not because they believe in morality. They then enter the conventional phase, where they do the right thing to fulfill other people's expectations as well as their own duties. This is also the stage where these children begin to follow laws and understand them. The last stage, post-conventional, is when humans follow a set of principles centered around justice that they have developed internally. It is their own moral code. They learn to act for themselves and also for others. They also follow what they believe is ethical and just, regardless of what others do. A well-known critic of Kohlberg's stages is Carol Gilligan, who pointed out that Kohlberg only observed and sampled males in his study. Psychologically speaking, she believed that men follow logic and justice, while women tend to consider interpersonal relationships more. Therefore, according to Gilligan, Kohlberg's stages cannot be easily generalized to women because women can potentially interpret and operate morality in a different manner. The correct answer here is E, because none of the other points were mentioned by Carol Gilligan. Hopefully some of the questions that I picked gave you an idea of the range and diversity of topics you'll see on the MCQ section of the AP Psychology exam. You might say that AP Psych is easier than some other courses because the questions are solely knowledge-based, so you can do them pretty quickly on the exam. They won't take up much of your time as long as you know the facts from each unit well. The AP Psych exam really is more about facts and less about skill.